you, Tony. Hope you can hear me all right. Yeah, thanks.
Yes.
Well, I'll try and be brief within my 5 minutes if I possibly can. I came into social work just after the 1970 Social Services Act, which, believe it or not, promoted a universalist approach to social care, with many, if not all, services free. Now, just think how far from that we now are. In the last 10 years, we've lost so much, diminished actually from social care, and the invisibility, the discrimination and the fragmentation, which has been described so vividly up into, by the previous speakers, leaves us in a very, very different and much worse position than when people like myself started. We need a new legislative approach altogether. Social care is not a burden, it's a fundamental right. Even a firm of city accountants have worked out that spending on wages and social care actually contributes 2.5 times the cost of the wages to the national economy. And yet somehow it's still put around in the mainstream press as if this was a burden. So we need a new legislative approach with 4 basic principles. I think equality, a universal right; diversity, nobody excluded; accessibility, no barriers, no means tests, and co-produced with users and carers; and reciprocity, nothing about us without us, as users and carers organisations often say. What would that look like? Well, if Tony shows the first and then the second slide, I can give you an idea of the principles involved. The Carers Trust, believe it or not, have put forward the proposed National Care Service in Scotland as a model in terms of principles. So if we can show the next slide, Tony, I'll quickly go through what these are. There we are. And the Carers Trust, and I agree with them, say that these are as good as you can get for a national care service. The question is they have to be put into practice. But nevertheless, this is now going to become law in the Scottish Care Bill, which all the parties there, although they differ on the implementation, agree with these points. Embed human rights and care support, increase equality and enable people and communities to thrive, ensure the National Care Service, however it's distributed in its powers, is an example of fair work practice, effectively co-designed service with people with lived and living experience, ensure that the care workforce is recognised and valued, improve outcomes through prevention and early intervention, getting away from the whole notion of crisis, provide financially sustainable caregiving security and stability to people and their carers, something that we know only too well doesn't happen at the moment, and ensure that the National Care Service communicates with people in an inclusive way. What they're actually doing, I'll say something quickly about Scotland, is they now have a bill in Parliament there, which is to be put into, go through the legislative process by 2025. All the parties agree that there should be a bill. The Labour Party have different questions about it to the SNP Green Coalition there, but they do all agree in the main tenets of having a national care service free at the point of need. It's in the policy memorandum for that says that they should shift the paradigm from burden to investment, from crisis to prevention. They should strengthen the foundations and value the workforce with terms and conditions appropriate to that, and support unpaid carers and enhance the voice of carers and users. They also say in their policy memorandum that it needs to reduce the gap between legislative intent and delivery, which is very interesting to see in an actual piece of legislation, admitting that it's all about implementation. And it will enshrine a right to breaks for carers and a right to have key visitors for residents and homes, and a commitment to co-production. And in that bill, they propose a school for co-design, which professionals and experts by experience, i.e. users, would actually take part in. And they also propose a steering group with users and carers on the whole implementation process, and a social covenant which people sign up to. In other words, everything would be written down and accountable in terms of provision. In Wales, they're putting forward something similar. It's a shared ambition for social care and a desire to have a national care service which the Plaid Cymru and Wales Labour Party jointly have a shared ambition for, what they call a cooperation agreement. And that's between 2022-25. And they're also going for parity of recognition and reward for social care and healthcare workers. The Scottish bill doesn't quite say that. The Welsh, in some ways, if it comes into being, goes further and actually recognises parity with the NHS as fundamental to a new care service. They have a terms of reference and an expert group which is charged with making it free at the point of need and continuing as a public service, and also having the aim to increase the percentage of publicly delivered care, and to increase the role of local government ownership and cooperatives. And the Senate committee, which is cross-party, is now finding ways to put that into practice. So already there is a consensus on public delivery and social care in Wales, which they haven't quite got in Scotland, although the Scottish bill is in other senses more ambitious. So that shows you where we could be, even in the current straitened financial circumstances. The next slide is about how do we get there? Well, we need a movement in England, I think, for a universalist approach, which, as I say, would not actually be new, but it would be nice to have one in the current circumstances. And if Wales and Scotland can do it, surely we can have a movement in England which can bring about the 7 demands in social care disgrace, which are: the government shall have responsibility for and a duty to provide national care support and independent living service, and it will be fully funded through government investment and progressive taxation, free at the point of need, and fully available to all living in the country. Publicly provided, publicly accountable, and that means not-for-profits and cooperatives, but not the market within that. Mandated nationally and locally delivered, and identifying and addressing the needs of informal carers, family and friends providing personal support, and having a national employee strategy fit for purpose. That would, for instance, at the moment mean something like a minimum £15 per hour wage, and supporting the information of a task force on independent living. Now, in an inclusive way. So the last slide I have is, how do we get there? Well, we need a draft bill to be ready for 2024, clearly. And I would go much further than Wes Streeting already referred to, as Shadow Secretary has said, over 3 parliaments bit by bit. That is not the kind of approach. That's a fragmentation approach. We need surely a new legislative approach with some ambition, and a cross-interest alliance within to bring it about. That would include in social care disgrace, the National Pensioners Convention already signed up to a universal service, the disability groups like Disability Inclusion and DPAC and others, and the carers organisation like Carers UK, and unions like Unite, GMB, Unison, PCS, and indeed the Independent Workers of Great Britain, all of whom organise within our sector. Interestingly, the Labour Party conference policy actually asked for something like this, and citizens' assemblies, when they've been asked, have come back always with the same response. They want a universal, free, at the point of need social service. So it's vastly popular in every way in which it's been tested. In the first year, we should ask a Labour government to have public service contracts reintroduced, local authority capacity repaired, to boost the pay and conditions on the lines that we started to outline, and parity with the NHS at very least, to have a free personal care, which Hammersmith and Fulham already can do, even in the current straitened circumstances for people receiving home care, and to co-produce and have co-production embedded, working with users and carers on the design and the delivery of a new national service for care and support for independent living, and disabled people's organisations to help bring that about. Stop continuous care reassessments, which are these which make the lives of people with long-term conditions often and their families miserable when they get reassessed for possibly having to pay through a local authority mechanism rather than have an NHS free form of care. That needs to be completely abandoned in the first year. And care benefits should be inflation proofed and clearly a long-term plan produced for something like 10 years development. And all this could be encompassed in a new bill for a national care and support for independent living service. At least as good as that being outlined in Scotland and Wales, and England should no longer be the poor relation in all this. It's embarrassing, to say the least, for those of us who have been in social care so long, to feel that despite all our best efforts, the politicians and the others are letting us down. At least Labour Party is beginning to pick it up, but I think it needs a huge boost on the lines of what people have said earlier today, and a new bill, and a new ambition in a new parliament, and that could be got ready for 2024 with the possible cross-party and certainly a cross-group alliance and mobilisation from the base. So I'll stop at that point.
Thank you very much, Gordon. It's both bewildering but also encouraging that other countries other than England can get their heads round at least halfway towards a decent set of proposals.